Thank you. Good afternoon, everyone. And this is our Board of Health December meeting, and I would like to welcome you and pass on to Dr. Brophy, the chairperson of the Board of Health.
So I'd like to call the Board of Health meeting for December 1st, 2020 to order. First item on the agenda is board approval of the minutes from our November 3rd meeting. Mr. Fisk, any changes or edits to the minutes?
I see none.
Okay.
I agree with them as read.
Okay, so there's motion to approve and second.
Approved.
Aye. Okay.
Aye.
Been approved. Next item on the agenda is the life science bio-ready community adoption of the NIH guidelines. Is Mr. May or anyone from the city on for discussion?
I doubt that we have them today.
Okay.
Basically, I think our order is to continue our conversation with the other municipalities.
Okay.
To get their protocol, how they move their agenda forward to adopt the life science project. And so we will continue to work. I have some of the towns that I'm in conversation with. So as soon as we complete that, then we probably can I'll submit the information to the board,
Okay.
which I mean that, and then at the pleasure of the board, we will inform Mr. May and Faye, and perhaps bring them in again.
Okay. Very good.
Okay.
Okay. Next item is the board. The issue the board denied a request for the new tobacco license in the city.
Yes, this one we have sent a letter
Okay.
to the attorney representing the client. That's John McCloskey Law Firms.
Okay.
They do have some questions, and they are requesting some information, public record. So perhaps there will be some more requests to the board to that effect. But so far, that's where we are.
Okay. Thank you. Any questions, Mr. Fisker?
Not until I hear back from what they want to hear from us.
Okay, very good. All right. So, next item on the agenda is a new request. It's relating to hookah use in public areas in the city of Brockton. I
Okay.
believe there's two.
Yes, we do have. We receive a request from Chantal Sullivan, and let's see, we have another person. I have not seen him yet, so we will move ahead with Miss Chantal. Miss Chantal, good afternoon. Are you there? Can you you want to unmute yourself? Miss Sullivan?
You're muted.
Okay. Yes, we can. Okay.
Yeah, yeah. If you could speak up a little louder, you're not coming through very clearly.
Okay. So I'm Chantal Sullivan, a resident of Brockton, and then I was inquiring about the hookah license for the town and the community. I have a son that was born on New Year's Day, and then for his birthday coming, he's going to turn 23, and what he would like is a hookah party. And then I went to a few function hall and restaurant, and what I find out that Brockton did not approve a hookah license. So that's when I started talking to Mr. Lally, Mr. Council for my district, and I also reached out to the Board of Health to see how I can apply or what can we do to have the hookah license for Brockton, like to keep it in our community, so that would be if that's possible. Because I looked into it, I sent some information into Mr. Eno. I don't know if I had them, like some towns already have it, Boston, Everett, and it's just I just need to know what are the requirements in order to have that.
Well, thank you for raising that issue. I'll start, and then I'll let the directors of the Board of Health comment on that. if you have your private house and you decide to do something inside your bedroom, that's totally up to you inside your bedroom because no one is seeing you. But
Right?
tobacco and any smoking substances in public and in outdoor, it's not something that is that we license. For instance, as you know, in all restaurants throughout the Massachusetts, not just in Brockton, smoking is prohibited. And there are one exception to the rule, for instance, is that if you have a private club, now private club is managed and then you have to have membership to it. So that is something that where people can smoke. But requesting a day smoking license permit, I don't. This is not something that the city has, and I don't think that.
This would be for function or a club. I'm looking at a few places. That's why I'm trying to see how do we go about getting the license for the hookah license.
This is, Dr. Brockton, you're breaking up a bit, so it's not clear the question, but there is, if you're asking for a hookah license in Brockton, there is no licensing of hookah establishments here in the city of Brockton. As pointed out, there's a ban for in public areas for and public indoor, particularly areas such as restaurants, etc. That there is no smoking in those areas. The exception in the rule for the state is an existing club with membership that have had smoking permission that existed prior to the law going in place, and they were allowed to continue. For their members to continue smoking in those private membership clubs. And also the only other place that's allowed are what were smoke shops that had previously also had the ability to have smoking on their premises. So there is no area. That's why when if you're going to these restaurants or places, it's considered smoking and it is not allowed in those areas. So and I think in most areas now there are private hookah clubs in other towns that allow this. I don't know if they were, because they were not in the city of Brockton, whether they were existing smoke shops or existing private clubs that have become hookah clubs, because it's not within our jurisdiction, and I know they exist out there. But for the city, the city of Brockton, there is no difference in sort of a separate sort of a hookah type of license.
Okay, so my question is, let's say I decided to open a hookah lounge. How do I get the permit or the license to have that? Is my question to you guys. That's what I'm questioning.
To open a private club, I think, and right now, opening private clubs, I don't know the rules of private clubs. And what I don't know also is whether the law, before opening one, you should check to make sure that the law is not one that grandfathered in pre-existing private clubs. Because I don't know what the law says about clubs that are formed or private clubs that were formed after the public smoking ban went into place. And that's something certainly, the Department of Public Health and could be able to help you in advising you about that.
I think that's why that was the reason I asked for this meeting, to see how do we go about it. Like, if there's already a function or a club in place, how do we go about getting a license for that?
A license are you asking for a license for a club or a license? Again, you're breaking up a bit, so it's hard to understand what you're asking.
Permit for the hookah license. Permit for the hookah.
There is no permit for a hookah license in the city of Brockton. They don't exist.
I think, Doc, didn't we?
So what does exist? Like you guys just banned it. You cannot do it in Brockton, period. Is that the final list?
We don't.
Because I don't understand.
This was brought up. What is it about last summer, Doc? I think for a Cape Verdean restaurant. In fact, I go to it, and it's on Center Street here in Brockton. And the gentleman came before the board and everything about the hookah. And basically we left it, you know, it was the summer months, that if it was outside, we
Yeah.
kind of treated it like, you know, some of the other bars that have an outdoor porch for people to smoke on. But it had to be outside. It can't be in the club, and it's got to be outside.
That is
That
correct.
type of thing. We allowed that type of thing because, you know, we don't regulate it, but, you know, you just can't have any smoking inside of a restaurant or, you know, a function place or anything like that. But it was allowed, you know, outside. It would be a little chilly right now doing it, but, yeah, I think we, you know,
Oh, so it can be done outside the hall or outside the club, but not indoors.
No
That's correct.
smoking indoors, that is correct.
right.
And it also has to be not outdoors in a public area. It has to be the confined area of that was, you know, happening during the pandemic and the outdoor space that was happening because people were doing what they
People
normally
eating,
do
yeah.
in restaurants, going outside to smoke. They were standing out in the areas where they normally did smoke.
And it's not people eating near there, or,
Right,
you know,
exactly.
like they're sitting there eating, and, you know, it's outdoors, but people, you know, you can't be smoking right next to people eating outdoors. It was like a private area that was away from anybody eating, that type of thing.
Okay,
Uh,
so let's
hello,
say,
this is Fred Fontaine. I just joined the meeting, guys. You know, I'm sorry, you know, I was trying to link in, but I couldn't get in.
okay, Fred, you there?
Yes, I'm there. I was trying to link in, but I couldn't get it. I just get in. Sorry about it, folks.
Person.
Okay, all right.
Yeah.
All right. So the question that I had, so let's say at a function place, if we choose to have a smoking area outside, like you said, where people are not eating, and it would be just dedicated for people if they want to smoke.
It
If
has-
they want to smoke hookah.
If there is
Do I
a
still need something?
No, if
Why
there is,
still-
if there is a designated smoking area outside a facility that is outdoors, not within the facility, people can
Correct.
have that space, right, exactly. And during the pandemic, restaurants have, you know, walled off areas, outside, but it has to be an outdoor area.
Right.
And whatever place you have has to, allow that to happen. Not every outdoor place allows, even in their outdoor space, smoking to take place.
Okay. So
Okay.
so if the place allows it, do I still need something from you guys, a permit or permission for them to do that?
No,
For smoking outside, no.
no.
Yeah. And we would suggest that you also check with the state because smoking, as you know, not just tobacco, but smoking in general has several layers into it. You have the municipal layer or ground, and you have the state ground and federal. So there are many regulations that oversee this. And we also have some experts with us from the state, from DPH and the state health. We have Ms. Sarah McCognall, a friend that I work with for at least for 2 years since I've been at the Board of Health here. And also has Lisa, is that,
Stevens, good night.
okay, yes. So they are here with us also. And perhaps this is, I don't know if they want to weigh in, but we invited them because we're going to have a little bit of discussion on smoking in regulations. And we also welcome City President Mr. Honorable John Lally, who is serving right now as the acting mayor. I don't know if I should say this for today, but I know that I have a little bit of information, inside information, to know ahead of hand that Mr. Lally is joining us. He has also two hats today: the president of the City Council and also the acting mayor until the return of Mayor Sullivan.
Okay.
I've got a third hat. I've got a constituent here too.
So maybe folks from the state could comment on hookah licenses and permission around them, and you know, the difference between indoor and outdoor smoking, and the rules from the state. And
Want me to
My-
take that, Lisa, or do you want to?
Welcome, Lisa. Welcome.
Hi. Yes. So I don't know if you'd worked previously, if anybody had worked with DJ from the Massachusetts Municipal Association, but I took over from him in June. So that's why I'm a new face on the block. But yeah. So when it comes to hookah, if you're providing, the only thing that you want to be a little careful of is if there is the Massachusetts flavor law about flavored tobacco. Bans the sale and provision of flavored tobacco except at smoking bars in towns and cities that allow them. And so that's something that people who are usually that want to provide hookah do run up against sometimes, is that it's both the sale and provision. So it's not just if you're making money off of it, it's also just if you're providing it. And then again, that's restricted to smoking bars if they're allowed in a city or town, and that's just the state law rules they wrote.
I think the Board of Health members have accurately kind of picked the topic apart as far as what's allowed within a restaurant and what's not allowed, and what's allowed and not allowed within a private club. Private clubs have to be truly private. So if you decide to open a private club for hookah users, and I can come in and sit down as a non-member of that club, then it's not a private club. And in order to get that designation, you have to, as Dr. Mondesser said, different layers of regulations. You have to get licensing from the state to be a designated private club. And so there are a lot of hoops that you would have to jump through. In order to be a smoking bar, you would have to do the same thing. You would have to get a license from the Department of Revenue, and the sale of flavored tobacco products is allowed at a smoking bar. However, it's only allowed for on-site consumption. So people can't buy product and then take it home with them when they leave. It's only for on-site consumption. And that's part of the new 2019 state law. As far as a hookah party somewhere, as Dr. Mondesser said, if you want to have something like that in your home, you don't need a permit to have people over and smoke hookah in your home. But beyond that, there are some stringent regulations on the smoking of any sort of a product that the state would consider a tobacco product.
With
I
that
got a
said,
question.
I think that's the guideline that I'm looking into. If we wanted to do a hookah lounge, I guess the way you put it, it would be for members.
Not anybody from outside.
Yeah, you couldn't go to a private club now and say, I would like to have a hookah party at the private club, because you're not a member. And anyone who came to that party would also have to be members. No one can, in a private club that has this type of license, can allow people that are not members to use the right, the ability and regulations that are allowed for smoking within that club, unless they are a member of that club.
I do have a question on, and this is Fred Thornton, guys. Can you give me a chance to at least ask a few questions regarding that hookah thing? I've been in Brockton for the past 22 years as a businessman, and I also own the Perfect Place, which is on the south side of Brockton at the Kmart Plaza. So my question to you folks, since I know other cities allow people to have that, for instance, Worcester, Everett, Alston, Hyannis, Springfield, Charlestown. So I know they are inside. And they allow them to have those hookah to be used hookah inside. So if we want to do something like that in Brockton, what do we have to do to have a hookah? Because I'm not open every day. I open occasionally, not all the time. So what do I have to do to be allowed to have people coming inside once a week? Because, I'm not a bar per se that was open every day. So what should I do to be able to have that?
Mr. Fontaine, I believe you've mentioned cities that have smoking bars, and those are smoking bars that are licensed by the State Department of Revenue. Brockton does not currently have any smoking bars.
Okay, if I want to open one, for instance, on my place. So
Well, you
what
start with
should I
this
do?
state. You start with this state. You go to this state because it's this is something that is controlled or licensed not just by municipality, but it has the state regulations as well.
And Brockton,
Okay, so I have to go
we have
to the
no,
state first.
go ahead, sir.
Do I have to go to the state first and then comply with the city?
I think it would be a good idea for you to go to the Department of Revenue because first, because they have some stringent standards. You have to be able to show that at least 51% of your income is going to be tobacco sales related. And they would, if they issued you a license, they would also want to know that the city of Brockton intends to issue you a permit for the sale of hookah and tobacco products. My understanding is that the permits have reached their cap in Brockton. Am I correct on that?
That is correct.
That is correct.
So there can't be any new sales of tobacco products in any sort of a smoking bar or a store in Brockton currently if Brockton has reached its cap.
So that's a tough thing because every city now try, at least they get one hookah bar. I will probably not sell like tobacco per se, but if it's a hookah only, there's a way to do that.
So currently within the city, there is not.
Just for hookah only, not tobacco,
For tobacco,
Yes.
no, there are no new tobacco licenses being released by the city at this point. So if the way the law in the city stands right now is if there's a business that has an existing smoking license and that business is sold to a new owner, that license is passed to that new owner. If the license is retired and not renewed, the license is retired, and we do not allow new licenses to be put in place.
Oh. And there's
And then there, as pointed out, then there are state rules that the business has to have a certain requirement of the amount of dependence on tobacco, et cetera, before the state would even allow, if the license was available, that the state would even allow a hookah facility to open.
so we don't have any idea if soon they're gonna have extra, another way, when can we have another wave of something like that to happen in Brockton?
Well, there is a moratorium in place, so which means that I know you were a little bit you arrived a little bit late, but the moratorium was passed as of 2019, and so the total number of tobacco license being issued cannot. They cannot be new licenses, and a new place will not be issued unless it is a place that is already licensed and is being sold for the same purpose. So the license will continue under that same name within that same location. So that's the only exception currently.
So that means nothing could be done, like, oh my God. So Oh, yeah. So how soon then you think maybe we could have some extra, licenses coming up to Brockton?
Well, if you buy, I guess if you buy one store, that is
Stop
already
shop-
licensed.
Shop that moves out and is selling their facility, and they will, with that, sell you the license, will be part of the sales. Then the capability for that smoking shop that has the existing license is a site that could potentially go through the process of having hookah at that site. Yes.
Oh, boy. Okay. I understand. I get it. All right. So maybe I should take foot and see,
Okay. Oh.
maybe.
Okay.
See
We
what-
have a question. We have a question from Council President Lally. Yeah, go ahead, President Lally.
I just wanted to know, so that I did come in late. I apologize. I had problems signing in. And I will have to leave in a couple of minutes. I have a meeting at work. So just a quick question. The moratorium, is that, I don't recall, and I've been a counselor for a bit, I may have missed it, but was that put in by the Board of Health, or is that a state thing?
No, that is the Board of Health.
Board of Health, okay. So
When did we vote on that? That was a couple of years ago, wasn't it?
2019, I think.
Around 2019, if I.
Yeah. I did not want I did vote against it because I did want to extend the permits, but that's how it went.
Yeah, my only concern is, and I think with this interest in hookah, I think it would be prudent to at least re-examine it, because it is, smoking is not healthy. I'm not gonna sit here and advocate it, but I think that it is something that people are doing and they're gonna do. And if we whittle away all the stores we have here, that's not gonna stop anybody from doing it. Like, we're not, as far as the municipal government is concerned, we're not the only thing we're turning away is the taxes from the store. I don't think it's going to affect one way or the other the amount of people who choose to pick up the habit. So that was just my thought is, we do have interest from people in the business community, and no way in is a pretty swift way to shut the door on folks trying to open business. That's just
There's no way to get a new license. There are existing licenses out there, and those licenses, when available, are available for new businesses coming in. And there have been new businesses that have bought, people that have bought existing shops and gone and got their licenses. That license is part of that transfer of license is part of transfer of sale of the business. So.
Right. My concern is that, there's, I believe you had said that if I had a license and I closed my shop and I did not sell the license, we're now down one license. There's no way to.
Correct. That is correct.
So that was my concern. I think a cap on licenses, it makes sense, but a moratorium on new ones, I'm not so sure of. But again, I'm quite literally late to the meeting. So
yeah, part of the moratorium, if you looked at the city of Brockton back in 2019, the number of tobacco shops that we had per capita per number of citizens was beyond on a normal curve. We were way out there as being way above any other city. And the other issue with it at the time was that we were having issues with the ability of the Board of Health to even have enough staff to make sure that appropriate laws were being followed. we were having nicotine poisoning in young children. We were having problems with the sale of these flavored products. And so at that point, back then, we actually put our laws in place before the state laws went into place, and especially on flavored products, which allowed our city businesses to get rid of those products before they were no longer available for sale within the city. So, the law, we're still have a number of the number of licenses within the city is probably, we can go back and look at per number capita or per person in the city. But it's, you're speaking to an oncologist who deals with the consequences of smoking every day. Our job in the Board of Health is always public health. And to do as much to protect the health. And there'll always be a friction between us and the business community because it is the market in tobacco is a lucrative market. But we at the board at the time, our job is the health of the city, and that was the nidus for the law that is in place at the moment in the city.
Nope, makes sense. I appreciate the insight. This is why the Board of Health is the Board of Health, and the council is the council. They, we oversee our own things. You trust our judgment, I trust yours. No, so that was just my thing, is that just to get the conversation going, but I do appreciate it. Thank you.
All right, thank you. And thank you
Just
for your
Okay,
really quickly,
go ahead.
this is Lisa from the Massachusetts Municipal Association. One of the things I do as the Director of Tobacco Control is provide statewide assistance. And we also keep track of different policies that have been enacted in different municipalities across Massachusetts. So the majority, just really quickly, so smoking bars are banned in the majority, it's a slight majority, but in the majority of towns and cities in Massachusetts. So, but I'll say the vast majority of smoking bars are in a concentrated number of towns. So Worcester by far has the most smoking bars of any town or city, of any municipality. And beyond that, the vast majority are in Worcester. And the majority of towns and cities do not allow smoking bars. The same is also true for capping. It's a pretty data proven or evidence-based solution to what is known as a density problem. So that's certain neighborhoods tend to have a higher concentration of tobacco retailers. And one of the ways to address that is by implementing a cap, which is what Brockton has done. And it's been shown as a really successful way to reduce both exposure to tobacco products, especially among minors, and also as a way to reduce overall smoking rates in cities. And I can share some of that evidence with people if they're interested, but there's a pretty substantial body of research backing up that particular policy recommendation.
And I would say we were guided by the state and by your group at the time that we were putting ours in place to be compliant and with the policies in the state and best guidance and best practices that were being recommended by the state and I think it aligns, what we have here aligns with many of the other towns and cities in the state.
Yes, certainly.
Yeah. Thank you so much, everyone. Any other question around tobacco? Ms. McConnell, do you want to weigh in any more advice on tobacco in general, regulations and?
Well, I guess I would like to have an opportunity to talk about the services that my organization, Massachusetts Health Officers Association, provides to Brockton. There's been recently some, I guess, discontent about those services. So I want to make sure that that we have support from the city to be able to provide those services. Once a year, all tobacco vendors would be inspected by a trained inspector. And if there are any violations, they would get a second inspection. They'd be notified close after the first inspection what the violation was, and they'd certainly be given time to correct it. In addition to that, each tobacco vendor would receive what we call a compliance check. And that's when a trained underage buyer under the age of 21 would enter the tobacco retail establishment and attempt to purchase a tobacco product. Some people may not know, but part of the new state law is that all tobacco purchasers be asked for their identification, just like anybody buying a beer at Gillette Stadium or at Fenway Park. And so our goal is that anytime a youth goes into any of the licensed tobacco sale facilities, that they be asked for their identification. They won't have identification, and that they then be turned down for the sale. And that is our goal. Our goal is always to provide education on the effects of tobacco products and not punishing people who are using those tobacco products, but to provide the education and encouragement to quit. There are some currently open complaints
Yes.
that Department of Public Health has received from the city of Brockton, I believe, or regarding the city of Brockton. I believe there are 9 of them that have come in so far this year, and we need to get those wrapped up. We need to either have those inspections done by the health department staff, or my inspector, now that we're back providing you services, can go out and do them. And then we need to follow up with the Department of Public Health to let them know what the status was. Currently, there's a memorandum of understanding between the city of Brockton and the Massachusetts Health Officers Association to provide you with the services that you've been receiving since, I believe, 2019, maybe 2020, before the beginning of the pandemic at least. And that memorandum of understanding is going to be revised, assuming that my agency has funds to provide Brockton with tobacco control services in fiscal year 24. Brockton would need to commit to a couple things. One, bringing your local regulations up to date so that all of the new state law provisions would get incorporated into your regulations. And then you would also look at any other policies that you might be interested in, like last time you looked at permit capping. And then the other thing that Brockton would need to agree to do is enforcement, and that's been lax. We'd like to see that tightened up more. You know, the retailers that have sold to minors have been fined, but some retailers that have had other violations haven't been fined, things haven't been followed up on. So we need to see that all tightened up a little bit more before we can, before we can agree to go forward into the next fiscal year. So I think this gives us time to work on that and tighten up that process. And I'm happy to answer any questions you may have.
Yeah, thank you so much, Sarah. I think we have hit the nail on the head, because Board of Health is Board of Health, and we try to implement laws or best evidence, best practice around health. But not everyone in the city makes decisions, public health decisions. So we do what we do here. So I'm glad that you're here today with Lisa. I have yet to capture the last name, so please allow me to go with Lisa. So we want to move forward with the MOU and enforce the laws and regulations. So basically, we would love to be lenient on decisions as it relates to maybe financial or economics. But first and foremost, we are mandated to enforce public health regulation. So we will move ahead. And thank you for being with us. So I don't know if Dr. Murphy.
I would say the board fully supports that the laws that are in place should be enforced. We have appreciated your support during this time period, particularly during the pandemic when boards of health were stressed in other directions, and the job that you've done in helping us, and certainly some of the stuff that you brought up about newer laws and compliance is certainly working with you for what are the, updating our best practices within the city. We'd love to do that. And if we need to do that before the memorandum of understanding, to work with Dr. Montesor to go over that and point out the issues that we need to update here at the board. And we can relook at those, policies and that we have in place. And move forward, making some of the changes that are needed to keep us at best practice. So.
Very good, Dr. Brophy. Thank you. Thank you, Dr. Montesor.
Yeah, thank you so much for joining us. Thank you.
Is there any questions further regarding or any comments?
None here.
President Lally, any comment, question from your side?
All I gotta say is enforcement. We love enforcement. As much of it as we can get. If it's a law, we gotta be enforcing it. That's one of the code enforcement is one of the biggest things that we hear about. So, I think the council would be very happy to support whatever measures are necessary to make sure that the inspectional services from the Board of Health and the building department are inspecting and they're following up, and that the fines and penalties are effective as deterrents. But no, that's all I have. I appreciate it. I do have to head out, but I do thank you for having me.
And thank you.
Thank you for coming.
Thank you for coming, and thank you for the support of the board in the enforcement of the policies. Thank you for that.
Absolutely. Thank you, commissioners.
Any other questions?
None here.
Okay, great, wonderful. I'd like to thank you for joining us for the meeting. It was really helpful, and as I said, working with both of you over your groups over the last few years has been important to the city, and we definitely want to continue this moving forward. So I think we'll take the action plan away for Dr. Mansour to work with you, and let's get this moving so we can get things in place. Okay.
Music to our ears. Thank you very much, and thank you for the opportunity to meet with you tonight. Have a good night.
And I like the notes also. So we may call you back again.
Okay.
Thank you again. All right.
Thank you. Feel free to stay, or if you want to
drop off, please
that's
drop
fine.
off. Okay. All right. Thank you. All right. So good discussion there.
Yeah.
Yeah. All right. So I guess next item on the agenda, I guess we'll just run through all of the issues regarding COVID within the city, just an update for the
Yes,
public.
okay. So basically, we're looking at the COVID situation. It goes up and down. So this morning we had 23 new cases. So those cases are within the last 24 hours, numbers that were reported to Maven, the state surveillance, epidemiological surveillance system. The deaths, we up to 510 again. Well, the highest we've had. I guess the definition or classification has allowed for some other cases to be added to it. And so we've lost, within the past 3 weeks, we've lost about 4 cases, which brings it to the total number of deaths to 510. The wastewater sewer will continue to receive data, and that's one that shows us basically some level of COVID in the city.
Has that been going up?
Yes, I think
upward after the holiday. It will
yes,
upward.
it has,
Yeah.
because we had a small drop below 1 million copies per 1 liter of water of sewage,
Yeah.
but it has gone up over, I think 1.2 million or 1.4 millions
Yeah.
back up again.
Yeah, we're seeing it, this is the post-Thanksgiving holiday where people gathered, et cetera, and again, are traveling, et cetera, and we are seeing an uptick, and I'm not surprised that in the city that we're seeing it. And the wastewater is probably the best estimate of the prevalence in the city, because people are testing at home, and the positive test rate is only those that are reported to the Department of Public Health. So we're still in a phase where it may even continue to go up for the next week or so.
Yes, and also the Curative Inc., the company that was doing PCR testing for us, has in fact closed. And so we no longer have them at the Shaw Center. The nurses continue to vaccinate. As I mentioned last month, we have the Shaw Center, Convenience Association. We also vaccinate, we do homebounds. Presently, we do homebounds every other Thursday. So one Thursday we are at the Convenience Association, and then the next Thursday we are at the we do the nurses, public health nurses do the home bound residents. We do have the high rises as well, low rises, and we do provide flu vaccines as well. Now for COVID vaccines, we do have gift cards that the state has provided. There are two categories. One that is paid by the state. Those are $75, and people coming to get vaccinated can get a card for any level of booster, primary, secondary, or primary series or boosters. And it's not by household, it's per family, per person, per individual. So anyone who gets a vaccine, COVID vaccine, can get a gift card. For now, let me make give a little explanation. We only have them for the Shaw Center and the Convenience Association. Now, for the level of the $75 level. There is a second category of cards being provided by CDC. Those cards, we can provide them any other at any other clinic, but they are $25.
Okay.
Yes.
So those are the ones like at the high rise and the other
Yes.
other facilities. Okay.
Yes.
Yeah. Okay.
So that's it for
For
COVID.
Okay. Great. And then any other the public health education or mental health issues in the city? Any updates on that?
We continue to participate at the behavioral task force, which is a large group in the city, and also the state mental health council. There are two big issues that continue to come up. It's homelessness and substance abuse, and how that impacts livelihood in the city. And so mental health is really a major issue right now, and many municipalities are looking into it, but we don't have the answer yet how to best assist in alleviating homelessness and also mental health issues, because they seem to be intertwined.
Yeah, up on the North Main Street, I know last year we saw the tents and they had heaters in it. It was a big unit type of thing. I think you remember that. Is that something that they plan on doing again? I don't know who did it, whether it was from the association up there, but across up on North Main Street in the little park there, they did have the tent up, and they had the heat inside and beds for people to at least to get them out of the cold anyway. Is that something that's being done again, or do you know anything about that?
I don't know if the city will do it again, but I think the mayor had a say in it. So it's not impossible that maybe we see it again if there is a need for it, a demand for it, which I think there is. But as the temperature, as the winter nears, we probably will have that. So I'll keep you posted when I hear anything from that.
Do you know any status on the shelters within the city? Are they full at this point, or are we, is there still capacity within?
With Father Bills,
Yeah,
I think he continues to receive numerous requests. One ability that that agency has is the capacity to relocate some of the staff or some of the residents to other shelters outside Brockton. I think they have one in Quincy, and that seemed to accommodate other people. But they also continue to work with the project they have on Belmont Street to see how they can get that running.
okay. So, any idea when that will be up and running?
I don't know. I don't have any dates from them,
Right.
but I would do follow up.
Just a follow up at what point, because certainly the board will be involved right with that opening up there. So it'd be good to know when it's coming our way. And you remain on the medical advisory committee for tuberculosis?
Yes, in fact, our next meeting is the 14th of this month, December 14th, because it's twice a month. Last month we traveled to Marlborough because it was an in-person. So our next meeting is in 2 weeks. Yes.
Within the city, the nurses are continuing with the preserved observation of treatment, right?
Yes, they continue to do the
right. Okay.
the DOT.
DOT.
Yes.
Yeah. Okay. Great. So, and I guess as far as monkey, well, you say monkeypox, but it's mpox now. The name has been changed.
Yes.
To mpox. So we have no cases within the city. The vaccine clinics are, as far as I know, the state is running the vaccine clinics. There's none in this city. I think Randolph is the closest, but for those that are interested, but at this point, the city, there are no cases.
No cases of monkeypox. We have seen an upsurge in the RSV among children, so that's very concerning. So yesterday I gave at the meeting with the heads of department, I give just a brief update on how the hospitals are being filled, the area hospitals, that is, with no cases of children coming to the hospital with RSV. So as we speak today, I don't know where we are with the capacity.
Yeah.
Yes.
But we're approaching this is again this has been the fear post the holiday that we will see this uptick, and the issue is whether or not there will be enough beds available. But it is, I think, across the state, beds are very tight because there's the pediatric beds that are needed. And in fact, some of the hospitals are converting units that were adult units into pediatric units in order to staff have enough staff and beds available for those involved. So I think just caution of people, particularly young children. It's particularly the young infant children that are at risk for the most severe disease, as well as people who are immunocompromised and the very elderly that are at risk. So caution for those, particularly with young children during this time, because it is the virus is fairly prevalent in the population right now.
Yes. Yeah.
Okay. All right, and then our next board meeting would be in January, but it's right after the holiday. So I think maybe what we should do, George, and this is is have it on the calendar, but if nothing comes in before the holiday, before Christmas, that we could cancel the meeting unless there's issues
Yeah, unless there's something that
Unless there's something
needs
that
our,
needs our attention.
needs to be heard, right?
Right, because it is, between now and that next meeting, I doubt that there'll be any newer items on the agenda. There might be, so let's put them, leave the meeting as one scheduled, but before the holiday, if something has come in to meet, we will plan to meet, but if nothing has come in that needs our attention before the holidays period begins, then
We'll make ourselves available.
make ourselves available to meet on that day, but we may cancel the meeting if nothing needs to be addressed. And then our meeting then would be on February, I didn't have my February calendar with me. 1 second. But we will plan the meeting it will be January 2nd, 3rd, 4th. January 5th is the next planned meeting. If that meeting does not occur, then we will be meeting the first Thursday in February.
Yes, that is, let's see what I have here. 2023. So February will be, actually it would be February 2nd.
February 2nd.
Second.
Okay. All right. Okay. So George, if you can have those on your calendar, that'd be great.
Always
other-
available.
Any other issues?
No,
So motion to adjourn?
motion to adjourn.
All right, thanks, everyone, and
Thank
happy
you, and
happy
Merry
holidays,
Christmas and Happy New Year.
Happy New Year, and we'll
Yep.
meet again in New Year's. Okay.
Okay.
Thank you. Thank
Bye-bye.
you, same to you all.
Bye-bye.
Thank you for joining.